Thank you very much for being here today. My name is Laura Chambers, and I'm the director of the Employee Group Insurance Program as well as the Student Program. So everything I'm going to present to you today is about the Affordable Care Act, but we are also going to talk about, and Ivan specifically is going to speak to you about the Blue Cross Blue Shield student insurance plan that all of you have available to you as a student at UTPA American. The great thing about what we've done with Blue Cross is that we've done all the research for you, and we've designed the plan for you. So that's something that you don't have to worry about, and know that there was a team of individuals at UT System that made sure that we were offering a benefit program that suited the needs of our students. So first, thank you those of you that are sitting in the front row. You were either late or you were the first here, and if it's anything like when I was in college, you get an automatic A in a class for taking the front row, so congratulations. You should be the first to the pizza, is what I'm going to go ahead and tell everyone. Again, I want to make this presentation very casual. If you have questions, please ask. It is the very first time we've given this presentation. If it is too much at a high level, because insurance is very confusing, raise your hand and tell me to bring it down a little bit. I've been doing this for over 20 years, so it all makes perfect sense to me, but I can remember being right out of college and not having a clue what insurance was or how it worked. So I want to start with that real quick. Can I see by raise of hands the number of you that currently have insurance through your mom or dad's insurance plan? Okay, good. And then how many of you have already picked up insurance through the federal marketplace, known by some as the Affordable Care Act or Obamacare or the Patient Protection Act? Has all different kinds of names. Has anyone done that? Okay, and that's fine too. It's very confusing, and if you paid attention to the news, they just got the website working in the recent couple of months, so you haven't missed out too much on anything. I'm going to guess by, if you can raise your hand, if you're still curious about insurance, you're not sure what you want to do, you may have a small policy, but you think you need more coverage. Okay, and how many of you are here for the pizza and the $5 gift card? Okay, that's good for me to know too. Okay, so I'll go ahead and start. We're going to run through really what the Affordable Care Act is. We're going to talk about healthcare.gov. We're going to go through what you have access to as a student and what's offered by Academic Health Plan. So why is student insurance beneficial to you? The reason it's beneficial, as I said before, there's a team of individuals, actually you're looking at the team, it's really Sarah and I, at UT System that went out to the competitive marketplace and bid the program on your behalf. We went and talked to many, many insurers about who could offer our students the best plan with the best benefits at the best premium rate. Again, we did that so that you don't have to worry about that. So what are the changes under the Affordable Care Act? Show of hands again, how many of you have actually paid attention? Okay, would it help everyone if I take just a minute to describe what insurance is and how insurance works? Would that help everyone? Okay, so think of insurance as something that you're going to pay money into. That's called a premium. So you're going to pay a premium, and in return for that premium, you have coverage that will cover your doctor visits and your hospital visits and any outpatient care that you may have. Okay? Very, very different than any care you receive under the Student Health Center here at UT Pan Am. Okay, the Student Health Center is something that you have provided to you by way of your student fees. Health insurance is completely different. For those, very, very similar to automobile insurance, you or your parents pay a premium. When you're in an accident, the insurance company helps to pay for the repairs to your car. Think of it that way. You pay a health insurance premium, and Blue Cross and Blue Shield or a plan on the marketplace are going to help pay for repairs to you in an accident or sickness. Does that help a little bit? In general, and very simple way of thinking about insurance, is the lower your premium, the less benefits you receive, okay? Same concept, if you spend very, very little at the grocery store, you probably walked home with very little food. The more you spend, the more you get. So very basic concepts of business management. Spend more, get more. Does that help everyone just a little bit kind of understand how it works? Okay. The student insurance plan that you have available to you here at UTPA is available to you at a significantly discounted rate, because what we did when we went out to the marketplace, we said we have potentially 250,000 students around the state that can enroll in this plan, and as a result of that, we want you to give us the best rate possible. Very different rate than if you were to go shop for insurance all by yourself, okay? So we're going to go through some pieces of the Affordable Care Act. I'm going to explain the Affordable Care Act to you, what some of the requirements are for 2014 and what's coming up and some things that you need to pay attention to. Know that your student health center is not going to cover all of your health care needs. So for those of you that are wondering if you even need health insurance, you need to think of the terms of if you're in a car accident, or you're at the beach and you injure yourself, you break a leg, you do something that is outside the normal strep throat or sinus infection or something like that, you need assistance in covering that. Unless all of you have a tremendous access to money, insurance is a great thing, okay? Keep that in mind. I know all of you are very young, you're very healthy, you don't need it. That's exactly what I thought too. That's what everyone who's under the age of 30 thinks, so you're not alone, okay? Okay, so healthcare reform. So part of being a student is that the Affordable Care Act, which was passed in March 2010 by Congress, authored by many, many people. If you care to read it, it's about 3,000 pages long is how long the actual legislation is, and it took many, many months for various leaders to get through to really kind of dial that down as to what exactly does that mean. The bottom line is the Affordable Care Act requires all United States citizens, visitors with holding J1 and J2 visas, this includes students, all of you, to have insurance if you are residing in the United States. And your insurance has to meet minimal essential benefits. What are minimal essential benefits? Just think about it as a way of just basic coverage. Has to meet basic criteria, okay? Let me flip through here. It's sort of difficult to look back this way. All right, so part though of offering a student insurance plan is we can't screen you to make sure that you're healthy in order to get into the plan. Before the Affordable Care Act, insurance companies could screen you to make sure you were healthy, and if you were healthy, then they would give you insurance. That's now gone. No longer can insurance companies do that. So if you're a student, you're eligible for the student plan. The marketplace is something that has been set up for students and individuals of the United States to go out and purchase insurance through the marketplace. And think of the marketplace as literally just an open market on the internet where you can pick and choose what plans you want and how much you want to pay for health care. There's nothing too special about it, really. All of the major insurance companies in the United States have a plan that's offered on the marketplace. All of it is rated for the Valley area, or we're from Austin, so Austin, Texas has a different rate than the Valley. Houston has a different premium, if you will, than the rest of the state. So it's all rated based on that community. And usually they do that based on the health of the community, okay? Some of the requirements are that you have 100% coverage for preventative care. Did most of you grow up with a mom and dad who said you need to get an annual checkup every single year just to make sure everything's working correctly? Okay, that is now covered at 100% by the student health plan and any employer plan offered in the United States. It has to be covered at 100%. Okay, great thing. There is absolutely no reason now not to have that visit every single year with your doctor. Okay. The only thing that really determines your eligibility for the student insurance plan offered here at UTPA is the fact that you're a student, okay? It doesn't matter the number of hours that you take, but you must be enrolled as a student. Your dependents are also eligible for the student plan we offer here at UT Pan American, just as they are on the marketplace. I'm going to stop just a second. Are there any questions so far from the audience? Okay, sorry, we're getting closer to the pizza. There's a question? Oh, yes.
You said some of us were enrolled. So if we enroll in the student coverage during the semesters, fall and spring, but we're not enrolled during the summer, will our coverage end?
No. So the question was, is if you enroll in the student insurance in the fall or the spring, and you're not a student in the summer, do you get to keep the insurance over the summer? Did I state that correctly? Okay. The answer is you get to keep that insurance. As long as you were enrolled in the spring, you get to keep that insurance throughout the summer. Okay?
Can you step up to the microphone, please?
What is the cost of the insurance?
The annual cost, and the question was, what is the annual cost of what is the cost of the insurance? Ivan will go over that in specific details, but roughly it's about $1,200 a year. A little bit more than that. As a comparison to help you, our employee plan that we offer to employees that is funded by the state, so the employee doesn't actually have to pay this, is almost $500 a month. So it's more like $6,000 a year. So $1,200 a year, very, very good benefit. And again, it's because we took a large group of students and said, Blue Cross, this is how many students could potentially enroll in the plan. Yes, sir?
What about some of us who are planning to graduate in the next couple of semesters? Are we still be covered, or how does that work?
Once you graduate, you were no longer covered by the plan, but as long as you're enrolled at the time of graduation, well, it'll cover you to the end of that semester. If you graduate in the spring, it'll cover you to the end of the summer, because the assumption is you enrolled in the spring and you get to keep it through the summer. Ivan will go over those details. It sounds to me like you guys are maybe more interested in what actually you can enroll in here versus the Affordable Care Act. So how about I hit highlights of the Affordable Care Act so that you can have a great, intelligent conversation with people at a cocktail party or frat party or whatever college kids do these days? Because I know you're going to hang out and talk about health insurance. Okay, so really quick, I'll go over. Sorry, again, first time to do the presentation. This is taking some clicks. Okay, so they have to satisfy the individual mandate. Again, we have to satisfy what the federal government has said is basic coverage. We satisfy that. The student plans are not on the federal marketplace, okay? So if you go online and you attempt to find a student insurance program that is priced like your UTPA plan, and has the same plan design, you're not going to find it. One of the things that was decided in Washington was that for universities to continue to offer student insurance plans, certain things had to happen. It can only be offered to students and their families, has to meet minimum coverage, basic coverage, if you will, and it cannot be sold to anyone outside of the university. And the reason for that is if we sold this plan outside the university, most of your community would buy it because it's such a great price. And that's unfair competition. And I have a note that's about to be passed to me. Okay. Students, please come to the microphone if you have a question. I've done now my job and I'll move forward. All right. Am I pointing this to Sarah correctly? All right. We don't need to go over that. Okay, this is a very complicated slide. Essentially, though, this is basically saying that minimal essential coverage, that if you have Medicaid or Medicare or the Children's Health Insurance Plan or TRICARE, you meet the minimal essential coverage that's required by Washington. This, again, is not, our plan's not offered on the marketplace. You can buy plans on the marketplace. Think of when you shop, say at Amazon, and you're looking for, I don't know, what do students look for on Amazon? Hoodies? Jacket, textbooks? Okay, so you're looking at textbooks, and you compare, and I'm assuming it tells you the quality, if it's a new book, a used book, beaten book, not good shape, whatever it tells you. Same thing with the marketplace. It's going to tell you if it's a high-level plan, a low-level plan, and what the premium is. So that's really what the marketplace does, is it helps you shop and guide through the internet to find good policies. Okay, so here's the part that I really want students to pay attention to. We meet the individual mandate, that's great. Okay, so effective in 2014, part of the Affordable Care Act says that if you do not have health insurance that meets the basic coverage, remember minimal essential coverage, you will be fined a penalty of $95 for this first year, or 1% of your income. Most students don't necessarily have an income, so most students will probably be fined $95. In year 2, it will increase by the Consumer Price Index after the base of $695 has been set. So in 2014, your penalty would be $95. Next year, in 2015, your penalty by the federal government for not having health insurance is $695. Okay, and it's not just you, it's every citizen of the United States will be hit with that penalty. Okay? That's supposed to scare everyone into enrolling in coverage. Did it work? Are you all going to go run out and enroll in coverage? Some won't for $95, but I bet in year 2, $695, we hope some people enroll. Okay, so this goes over the individuals that are not mandated to purchase coverage and certain groups that are mandated but won't be hit with a penalty. We don't necessarily need to go through this, but in general, on the left-hand side, if you have an income below a certain level, they're not going to give you the penalty, but they are going to require that you have insurance. If you're an individual that's part of an Indian tribe, they're not going to hit you with the penalty, but they're going to require you have coverage. Those are just some examples. On the right-hand side, these are types of individuals that don't even have to have the coverage. If it's against their religious belief, people who are incarcerated, since all of you are sitting here waiting for pizza, you're not in jail, congratulations, you need health insurance. Okay? Okay, so essential, we covered that just a little bit, basic health care. And everyone, just to remind you again, preventative exams, hospitalizations, coverage at your doctor's office, coverage at outpatient clinics, broken legs, sprains, basic common health insurance that you would think of or maybe you don't think of. Again, I know you're all young and very healthy and you don't think about those things or necessarily think you need them, but it's important. No annual or lifetime benefits happen in 2014, and I'll describe to you what that is. In today's world, many plans have a limit of, let's just say, $300,000. And after $300,000 has been paid out by the insurance company, you have no more coverage. Kind of like your automobile insurance. After they've paid out a certain amount, you either don't have coverage or they're going to raise your premium. That now goes away in health insurance in the United States. That cannot happen any longer. As an example, the typical cost of care for cancer in the United States, this is just, let's just say breast cancer, common stage 1 breast cancer is about $250,000. Okay, having a baby, if any of you are planning to have a baby, notice I said planning to have a baby, okay. Typical cost to have a baby is about $35,000. Okay, it's not cheap. Typical broken leg, if after you go to the emergency room, they give you the x-ray, you have a cast, you move forward, about $5,000. So it's not cheap. Sinus infections are cheap, strep throat is cheap. Anything above and beyond that is not inexpensive, okay? Important to understand that. There are, you heard me say that, you know, back long ago, or really right now, that if you, employers used to be able to say, oh, or insurance companies, if you're not healthy, we don't have to cover you. That now goes away. That's called pre-existing condition. I'm not sure why that doesn't want to move. Sarah, can you move that? Okay, again, this gets back to the essential health benefits, basic again, emergency care, hospitalization, maternity, newborn, rehab, prescription medication, lab work, things of that nature. This side you don't need to really worry about because we make sure that you're covered in that area. That's an expansion. If any of you want to stay after this presentation, and I can go really deep into the Affordable Care Act, I'm more than happy to do that, but this is just a general overview. All right. Again, basic insurance coverage is what's required, offered by a licensed insurer. This is really, really important. You do not necessarily have to, Ivan's going to hate that I say this, have to purchase the UTPA Blue Cross coverage. You do not have to do that. We have it available for you. If you do not decide to purchase that, go to the marketplace. Do not go to someone you're not familiar with. Do not go to a website where you think you really got a great deal. Everything that is out on the federal marketplace at healthcare.gov and then what the university offers you has been vetted. The benefits are there. We are there to take care of you. I cannot say that about everyone on the internet. So just know that. Go to reliable sources for coverage if you're interested. And I know after this presentation, you're all going to be extremely interested, right? Okay. Again, student health plans are more affordable. The enrollment is extremely easy. You could whip out an iPad right now and enroll and you'd be done. The 100% coverage through the student health center, if you have our insurance, you're covered at 100% through them. The whole program around the state supports all of our student health centers. The network is very, very broad. If you were to enroll in our plan, you actually have access to all Blue Cross Blue Shield providers around the state and the nation. So I don't want you to think if you enroll in a plan that's offered here in the Edinburgh area that you only can see doctors in this area. Okay, it's any Blue Cross doctor across the state. We have essential health benefits. I want to talk real quick about the marketplace and premium tax credit. If you earn under a certain income, and it's a very complicated measure, but it's basically 400% of the federal poverty level, which in today's dollars is about, if you earn less than $46,000 a year, I would guess many of you earn less than that. There are many people in my office that earn less than that. You're eligible for some assistance from the federal government. And so it may be something that you do want to go look at the marketplace to see if you're eligible for some financial assistance through one of the programs offered on the marketplace. But here's one of the things to keep in mind. By the time you apply for a plan on the marketplace and you choose your benefit out there on the marketplace and you get that assistance, your out-of-pocket cost will be very similar to what it would be under the student health plan. And that's why the student health plan offered here is so highly regulated by the federal government, is because it's a very unique and special benefit. The other things to keep in mind if you are shopping for health care is that our student health plan, and this is going to sound very foreign, but it's a platinum level plan. So think about it in terms of metallic colors or in terms of the Olympic gold, silver, bronze medals. Throw in a platinum in there, platinum being the richest benefit you can possibly buy on insurance. The student insurance plan is a platinum level plan, but the premium you pay is priced more at the bronze level. So you get more for the dollars that you spend. And you're going to hear a lot of reference on CNN and the news or whatnot to the various gold level plans, and that's really what the federal government decided to do as the easiest way to market it. The richer the gold, the richer the benefit, or the richer the metal, the richer the benefit. Does that make sense? Okay. There we go, thanks. All right, so one of the things that the federal government said is that everyone has to get a summary benefit description. Not really a big deal. You're going to get a booklet after you get enrolled that tells you all of the benefits that you have, that outlines what your coverage is. Blue Cross and Blue Shield has some various tools that you can look at that we've helped develop with them that talk about reform, and we can go through some of those things. But what you need to keep in mind is that health insurance is now required in the United States. You can be covered by your mom and dad through the age of 26. Once you turn 26, your parents can't cover you any longer. Okay, and that's when essentially you're on your own to go shop for your own coverage. So really important for those of you that are approaching that age to remember. Ivan is down here often. Sarah and I can come more often to answer questions or do one-on-one workshops with you if you have questions. So this coming fall semester, individual mandate will kick in. You have to have the coverage. Essential benefits have to be covered by all plans, all student health plans. No pre-existing condition, unlimited lifetime maximums. And what I say to employees, because we've had unlimited max on the employee plan for a long time, and it's a really bad joke, but I'm just going to say it. You can have a baby, have cancer, have a leg amputated, have just about anything you can imagine have done under the health plan, and it's going to be covered because there's no limit on that. That is an enormous benefit. Think about that in terms of, in today's world, it's typically a $200,000, $300,000 limit. So when you hear conversations in the news media talking about insurance is going to get more expensive, you know, what are we going to do as a nation to take care of this because it's just going to cost more money? Well, that's why it's going to cost more money, is because just basically almost everything is going to be covered unless it's experimental treatment. Okay, so broader coverage, great thing for the nation, and I think a great thing for individuals who need the health coverage. Okay, so the federal health insurance marketplace, if you want to learn more, you can go to healthcare.gov. Ivan, do you want me to turn it over to you at this point, or would you prefer I take questions? Okay, I'll turn it over to you.
Thank you, Laura. Good afternoon, everyone. My name is Ivan Kopecki, and I'm with Academic Health Plans. And basically, our role in all of this is to, what we do is we get you enrolled. So we take care of all the enrollment, all of the collection of the premium, get you entered into the Blue Cross Blue Shield system, and then Blue Cross Blue Shield will provide the insurance. Does everybody understand that? We're just like an administrator to get the information to Blue Cross Blue Shield. This is what our website looks like up here. Which one is the, like?
Oh, the pointer?
Yeah. Can anybody tell me which one's the
What's the pointer?
the laser?
Pointer?
Is it on here? Sorry, bear with me just a second. It's the one in the middle, okay. Okay, this is what our website looks like when you go to our website. I'm going to give you that in just a second. Once you click on the website, it has a lot of different information out here that Laura was talking to about various plans and advantages of taking the Blue Cross Blue Shield Student Academic Health Plan. You have a link to the school website here at Pan American. There's a frequent asked questions about the Affordable Care Act, many of the things that Laura went over this morning with you. There's Affordable Care Act. There's an actual webinar that is in-depth presentation of the Affordable Care Act, similar to what Laura had. There's how to change your address and email information once you enroll. How to access Blue Cross or Blue Access for members. That's a online program with Blue Cross Blue Shield where you go on their website and you can see all of your claims information out there and find out a whole bunch of information about, there's a medical encyclopedia out there. There's just a whole wealth of information if you're trying to look up what should I do about a sore throat. There, you know, you can take advantage of all that. There's how to log in to the Blue Access for Members site, how you do that, how you find your group number and ID number. And when you click on that, you basically just put in your name and your student ID number and then your zip code, and it'll tell you what your group number is and your policy number if you need to get that information quickly. Let's see here. There are what's called Blue 65. This is a group of discount programs that are available to you through Blue Cross and Blue Shield. Like you can get eye exams, eyeglasses, contacts, all at a discount. by going to certain providers, and it's all free through Blue Cross Blue Shield. There are some discounts for vitamins. There's discounts for different items like yoga and things like that that are out there. So there are just some value-added programs by Blue Cross and Blue Shield. Blue Care Connection is a program for people who have specific diseases, things like diabetes or hypertension or whatever it might be. You can get in touch with a case manager that can help you manage that disease and teach you about it and make sure you're taking your medicines and just help you in general with those things. There's also a 24-hour nurse line that you can call. So if you just don't feel well and you don't want to have to maybe walk all the way across campus, then you can maybe start there first and find out some information about what might be going on with you before you make that trek over to the student center. But it's just an offering for you. Under this tab, if you decide to enroll in the student health plan, you'll see an Enroll Online feature right here. That's what you would click on and just fill out the information that's asked, your name, your address, your student ID number. You would just go into that and just fill that out, and you can charge it on a credit card and just pay your credit card off. If you enroll today, you're covered at midnight tonight, so you can be covered that fast. So you don't have to wait a long period of time. And you will get an ID card mailed to your home, usually within about 7 to 10 days of you enrolling. So that's how you would enroll in the plan. There's also a premium cost page right here. One of the gentlemen in the back asked what's the cost of the plan, and I'm going to go to this in just a few minutes and show you, but it'll talk about what the various charges are for the semesters. Then there are, one of the students asked about what happens when I graduate. And like Laura said, you can stay till the end of the semester once you graduate, but you also have the opportunity to buy what's called continuation of coverage. So out in the commercial world, it's called COBRA. When you leave your job, you can buy some additional coverage. With this plan, if you've been on the plan for at least 6 months and you graduate or lose your coverage for some reason, you can buy an additional 6 months if you've been on it for 6 months without being a student. So that's to give you, if you go looking for a job, some employers may want you to, or you may have a 90-day waiting period before you get your benefits, so you could buy some additional coverage here without being a student to fill that gap in. That's available to you. Right up here under benefits, we have the highlights of the plans. We have a brochure about the plan, how to get your temporary ID card. Right here is find a doctor or hospital. So if you're looking for a doctor in this particular area, you would just click on that, and then it opens up and it asks, what are you looking for? If you're looking for a family practice doctor or an OBGYN, you just put in the zip code for down here, and it'll give you all the doctors that are on the Blue Cross Blue Shield network that you can use that are in-network providers. Okay? There's also, we have an optional dental plan, and you can find dentists as well on there by looking at the dental plan and then finding a dental provider. Under academic emergency services down at the very bottom, this is an additional coverage that's given to you when you buy the student health plan. And what that has to do is if you are traveling and you need to be evacuated and brought back home, that will give you some additional coverage for you to do that. And then I hate to even talk about this, but in the event that there's a death, there is repatriation of your remains back to your family. So if something, let's just say you went to Cancun for the weekend and something happened, and I know nobody's going to Cancun for spring break, but if you did and something happened down there, then part of the policy is that would be available to you as part of the health plan. So that's one of the things, an advantage of buying this plan over being in the marketplace. You can see it has a lot of extra value added features to it that can help you out in the event that certain things happen. And then out here under claims, for the most part, if you're going to an in-network Blue Cross Blue Shield doctor, they'll take care of filing all the claims for you, so you don't have to worry about that. But in the event that you would have to, for some reason, if you went out of network, all the different forms and procedures on how to do that are out there. And then on our website, we also have a toll-free number where you can always call and get additional information about things. They're there Monday through Friday from 8 to 5 at a toll-free number. Okay, Sarah, will you go ahead and go to the benefits page? I know I'm standing between y'all and pizza, so I'm going to just roughly walk through what the benefits are. Laura talked about what the essential benefits are for plans that are out on the website, the government website, but these are the actual benefits that are actually available through this plan when you purchase it. The academic health, the benefit highlight sheet. Oh, that's okay. I know I've kind of talked fast. Are there any questions just so far, real quickly? Yes, ma'am.
So basically, we have one more, I know the deadline is March 31st, but we have one more year because I can either pay $1,200 or $900.
That's correct. I mean, you have that choice of what you want to do. Right. We're going to show you the cost page here at the end, so it'll show you what it'll cost for the semester and what's available to you. So bear with me for just a second. If you'll go to page 2. Yeah, didn't. Real briefly, this is a snapshot. I'm not going to go over everything, but Laura talked about a maximum of the policy. For this calendar year, 13-14, the maximum on this plan is $500,000. That just means if Blue Cross Blue Shield would pay out $500,000 on your behalf, that's the cap of the plan. With the Affordable Care Act last year, it was $100,000. This year, it's $500,000. And as Laura said, next year when this rolls out, it'll be unlimited. But from today until the end of this year, it'll be at $500,000. You have a $300 deductible on the plan. That is very low. In the marketplace out here in the commercial world, most of the plans, even on the gold, silver, and bronze plans and platinum plans, they're going to start like at a $500 or $750 deductible. They're going to go to $1,500, $2,500. I saw some as much on the website as $7,000 deductibles. That just means you have to pay that much before the insurance starts paying. With this plan, it's only $300, which is very low. I think Rick can attest that it doesn't take much to spend $300 at a doctor's office. So once you hit that, then from that point forward, if you're seeing an in-network Blue Cross Blue Shield doctor, after that it's paid at 80-20. Blue Cross will pay 80%, you pay 20%. Now the best thing about this plan that's not available out on the marketplace is that when you go see Rick at the Student Health Center here, we waive that deductible, and most things over here that they can do on campus are covered at 100%. So you really can't beat that. If you don't feel well and you go to the Student Health Center here, you're going to have very little out-of-pocket expense. That deductible is waived. But let's say that your doctor is in McAllen and you're not seen here on campus, then you would pay the first $300, and after you pay that, then Blue Cross, if it's a Blue Cross provider, will pay 80% of the bill, you pay 20%. Does that make sense to everybody? Okay. The 20% that you pay, if for some reason they would ever reach $3,000, let's just say, God forbid, you're out here on 281 is the name of the highway, and there's a car accident, and you get put into the hospital and it's a $200,000 bill. Well, I don't have that much in my checking account, but if that happened, then this policy I would only have to pay the 20% added up to $3,000 plus $300, it'd be $3,300, and Blue Cross will pay off the rest of that $200,000 hospital bill at 100% for me. So it's a safety net to keep you out of financial hardship on a large claim. Does that help? Make sense to you? That's how that cap works. If you go to a doctor who is out of the Blue Cross network and you have the right to do whichever way you want, it's 60-40 versus 80-20. So it costs you more money to go to a non-Blue Cross Blue Shield doctor. But Blue Cross Blue Shield, one of the advantages of using this company is that they have such large networks, chances are they're going to be in network with Blue Cross because they have a very vast, broad provider base here, not only in Texas, but across the country, and actually they have providers outside the country as well. Can you scroll up? Oh, there we go, on the prescription drug card. I want to let you know that you're going to get a prescription drug card with it. And what that includes is a $10 copay for any generic drugs for a 30-day supply. And then if you buy a name brand drug, it's $15 copay for a 30-day supply. So that can be filled at any CVS, Walgreens, HEB, whatever you have down here that's a major pharmacy. They can all be filled there for you. Had a question the other day about a $10 copay for generic. Someone said, well, Walmart has them for $3. Well, if it's only $3, you'll pay less, but no more than 10 for generics, because they kind of run across the board sometimes. So is everybody okay with that? If it's less, it's okay. If it's more, you're only going to pay up to 10. And that choice of that drug is between you and your doctor. Do I want generic drugs or do I want name brand drugs? So that's available for you as well. This is our website. Rick said that there's a connection to that from his website into ours. And so when you go to our website, this is where you would go to enroll. It's www.ahpcare.com/UT system. And then you just pick Pan American, and it would take you to the website. That's what it looks like, and it'll just take you right where I was showing you what was happening earlier. So you would just go to the enroll online, and that's how it would be done.
Just a second. Ladies and gentlemen, the link on the Student Health Service website will take you directly to Pan Am's page on the Blue Cross Blue Shield website. It's just off our main page. It's in the bottom right-hand corner. Okay.
But there'll be a test question something I said earlier, and this is going to be the test before you get pizza, is what's the best value for your dollar if you buy the student health plan? Where do you go first? To the Student Health Center here on campus. That's the best value for you. Obviously, if you cut your arm and you have a bone sticking out, you might need to call what number to go to the hospital? Is it 911? But in talking about that, I want you to understand that calling 911, had a student in Austin the other day that went 2 miles in an ambulance and the bill was $850. So you want to use that if you need it. If you just need a ride, it's a pretty expensive ride because you're going to pay for the first $300 and then 80/20 of $850 to go 2 miles. But obviously, if you're bleeding and things are crashing and the gorilla's sitting on your chest and you're having a heart attack, you need to call 911. But if I kicked my toe going to the refrigerator one night to get some cold beverage out of the freezer on Sunday when the Super Bowl's going on, and I'd stub my toe, do you think I need to call 911 to go to the emergency room? Because the emergency room is one of the highest costs of medicine that there is in this country. It's abused a lot. It's for people who really need it. And if you go to the emergency room, I would guess, Laura, probably the starting ticket to get in is probably at least $1,000. You're not going to get out for any less than that. So just remember, 80/20 of $1,000, that's $200 to go to the emergency room. So it can be very expensive. There are urgent care centers, after-hour care, and then, of course, if it happens during the day or during operating hours for the Student Health Center, go there. Yes, sir.
So you're saying it's 80/20, is it the first 300 and then 80/20 of those 700? End up paying $500?
Yes. What happens is if you go off campus, anywhere except at the Student Health Center here, you're going to the doctor, you pay the first $300 however you get there. If it's one visit to the doctor for $100 and then we put it in a deductible bucket, and once that bucket's full, you paid your $300, that's it for the rest of the year. Everything's paid at 80/20 after that. Does that make sense? That's probably the easiest analogy I can think of.
And I think we need to wrap this up a little bit because your pizza's waiting. If I can highlight a couple of things for you to remember. Health insurance is now required in the United States by every individual who is here, except for those certain groups that we talked about earlier. Penalty, as the young lady said back there, is only $95 this year. Next year it will be $695, and then $695 will go up after that. Please don't confuse yourself with everything you're hearing in the media about the Affordable Care Act or Obamacare or whatever you want to call it. For a student, the reality is all you need to remember is that you have to have health insurance. And everything you hear about in the media and online and whatnot, That's really coming from people like me who are employers, who it's going to cost millions of dollars now to cover our employees, millions more. And there are issues on the employer side. But in general, the Affordable Care Act does open up gateways for individuals to have access to really good health care at affordable rates. And so we have a plan here available for you. The marketplace is available for you. Don't confuse yourself with everything that you hear in the media. That's not really for you to worry about. If you have questions, we're available for questions, and I'm happy to answer any of those questions for you. Yes. That was not part of the Affordable Care Act. What Rick Perry did not sign off on as part of the Affordable Care Act is that states could expand eligibility for Medicaid, which meant the federal government had more control of the health care within the state. And Governor Perry chose not to expand Medicaid in the state of Texas. And when you expand Medicaid, that would have expanded the eligibility for certain individuals to get into Medicaid that are not currently eligible, and he chose not to do that. The other thing Governor Perry chose not to do was to have a state-run marketplace, because the reality of that is that would have required a brand-new state agency to basically run insurance programs, and there were many states around the nation that said, we don't need to do that, and we don't need to spend state resources to do that. The federal government can do that, and we can have the members of our great state go to the federal marketplace or through student insurance or private employer. Go ahead and throw that out there, too. Yes, ma'am.
But you said that if you're under the Student Affordable Act, that pregnancy, giving birth is also covered.
Yes.
So would that make students give birth while they're still students because it's covered?
So the question, well, I think the question is if you become pregnant while you're a student and you're covered under this plan, do you have to actually deliver the baby while you're still on the plan?
No.
Or were you thinking I was suggesting hurry up and go get pregnant so you can get 100% coverage? No. Again, I said planned pregnancy. That usually comes first comes love, then comes marriage, then comes the baby and the baby carriage. Affordable Care Act and insurance is nowhere in that song. Are there any other questions? Sarah and I and Ivan will be here if any of you want to come up and ask us personal questions. We're more than happy to do that. Thank you so much.